CPTs to create better doctors.
Provide health education on a larger level than just in the clinic.
In the eyes of many Rancho Cordova residents, I think it's humanized physicians.
Really see how important this work is for the physicians to get out of the hospital and get into the community, and then for the community and for the children to have an opportunity to work with doctors outside of a hospital setting and see them for the real people that they can be.
CPT has allowed them to reconnect with what brought them into medicine in the first place, and that has been fun, seeing what energy they have coming back from their intern CPT rotation.
In 2010, we changed the name from Communities and Physicians Together to CHPT, Communities and Health Professionals Together, to really underscore the interdisciplinary nature of community health. We were talking about trainees not only in medicine, but also our nursing colleagues, public health colleagues, colleagues in nutrition and education, all of whom have a stake in the health of our communities. What CHPT is intended to do is provide the scaffolding for trainees, whether they be students, whether they be physicians and health professionals in training, as well as faculty, to engage with communities in a way that's incredibly meaningful and that can be a true partnership.
The community partners have been so devoted to this program. Well, without them, this program would not succeed. This program is a partnership between our residency program and the community partners. They've been so committed to keeping the program going, and so I can't thank our community partners enough for their commitment and their hard work.
We need to know how to work within the communities that we're serving. It's not enough to just do the medical part, because you need to know what's going to happen once they go home. It's, you have to know what the limitations are for whether or not they can comply with what you're prescribing for them and things like that. You have to know that you need to even ask those questions. And I know that a lot of people don't think that that's important, but it's of utmost importance, because it doesn't matter how smart you are as a doctor and what prescriptions or what you prescribe or anything like that. Even if it's the exact right thing, if your patient's not going to do it, then it doesn't work. So I think it's important for us to take a step back and get out of the hospital for a little bit and see what life is like for our patients.
It's not always about the number of people that come to the health fair or the number of people who come to the class. It's really about whether or not the resident has engaged the community, has gotten them excited about it, and really built the capacity in the community to carry it on post third year.
My name is Kelly Conley. I'm the coordinator at Tahoe Colonial Collaborative, and we have the internal medicine rotation all summer long, and we have the internal medicine doctors interact with the children at the Summer Friends camp.
We each had different doctors come to talk with us. I remember two of them. One, we had this one guy come in, and he was really tall, and I thought he was a parent. And we played some dodgeball, water dodgeball, and we all had a good time. Another one came in and talked to us about puberty and stuff.
fortunate to have a resident who was Slavic background, and she spoke the language. She knew about the health issues that really affected the Slavic community. This was a hard population for us to outreach to. We noticed that the Slavic community was getting information through media. So not only were they getting it through newspaper, they were always listening to the radio. So we linked up with our media folks in the Slavic community, and we thought of what a great way to create a radio show, a health radio show for her to do and talk about health topics during different times of this year. We did this project thinking like nothing was gonna happen, and we had no money. We had nothing. We just and that was the great thing about this project was we linked up people that, you know, we knew had different resources.
CPT allows doctors and the communities to work together as a team in order to help the overall child, and not just a one-way relationship in the 10 minutes that we have in the office setting.
Not only do I think it should continue, I think it should expand. I think that UC Davis definitely has touched on something that could have, you know, a far more reaching impact.
Health doesn't occur in the office and the hospital, that it occurs in the community, and that if they are not involved in the community, that they are missing a huge part of what it takes to take care of a person in the medical system.
CPT is doctors building community while the community is building doctors.